welcome to our lesson on lupus, also known as lupus erythematosus. This falls under the concept of immunity, which, just as a reminder, immunity is the body's natural or induced response to infection or anything associated with that. Unfortunately, lupus is an autoimmune disorder, meaning that the body has recognized tissues in the body as pathogens and has decided to attack them. So the body is constantly attacking itself. So it's a chronic inflammatory disease. The exact etiology is unknown, but there are a lot of risk factors which kind of point to maybe some of the etiology. And of course, just like any other autoimmune disorder that we talked about, there's periods of remission and periods of exacerbation. And our goal with somebody with lupus or with any autoimmune disorder is to get that person into remission and hopefully keep them there for a lifetime. So some of those risk factors include gender, more common in females, and genetics. This is more common in African Americans. There are specific triggers for every autoimmune disorder. Stress is usually always one, and then, illness can be one. There are some special triggers for lupus. Pregnancy is a big trigger, and pregnancy can be very dangerous for somebody with lupus, not only because it's a trigger, but because they can also pass that on to their fetus during pregnancy. UV light is also a big trigger for lupus. So when we talk about MS, heat can be a trigger for MS. UV light is a trigger for lupus. So try not to get those two mixed up. They're not the same thing. Right? And then there are some medications that can also trigger lupus. Lupus can be very hard to diagnose. The symptoms can be very insidious and can mimic a lot of other things. Fatigue is the number one complaint, and we've learned that fatigue is the number one complaint of all autoimmune disorders, and most of the time when people complain of fatigue, we're not immediately thinking lupus. There's also some other symptoms like trouble concentrating, joint pain. These next three are probably classic for lupus. The rash, this can be called a discoid rash. Looks like discs on the skin. Photosensitivity, again, that's that UV light. And then something called Raynaud's phenomenon, which is when blood flow is cut off to an extremity, usually of the fingers, and they can even change color in response to being cold. There's some other ones like dry mouth, dry eyes, hypertension, leukopenia, and thrombocytopenia. So those are some things that the leukopenia and the thrombocytopenia are the big things you'll see on the lab work. Here is the picture of that Raynaud's phenomenon, where the fingers can become white or blue. That's sometimes called dead man's fingers in response to cold. And then there's this rash. So they have the discoid rash sometimes on their skin, but then there's this specific rash. This is called a malar rash or a butterfly rash, and that spreads across the cheeks. So this is very hard to diagnose. Sometimes people live with this for years before they get a diagnosis. But we look at the patient's history, their complaints, how long this has been going on. The physical examination is really where we make the diagnosis, because there's not a lot of, other reliable diagnostic tests that we can use. We may see the anti-nuclear antibody be positive, but again, all that tells us is that there's an autoimmune disorder. It doesn't specifically tell us that it's lupus. So if they do have that malar rash, that's a good indication, or that those discoid lesions, Raynaud's phenomena, that kind of helps point in the direction of lupus. So treatment, there are a lot of medications that we use. Anti-malarials, that might sound weird to be using this, but they do decrease the inflammation. They're not exactly sure how it works. The major one that you'll see here is hydroxychloroquine. So something to remember about that is that it can be retinotoxic, so they need to be getting frequent eye exams, at least twice a year, to make sure they're not losing their vision because of this medication. NSAIDs, for the aches and the pains. They may use glucocorticoids or corticosteroids during an exacerbation, and then immunosuppressants to suppress the immune system to stop it from attacking itself. So that's not a new medication for you. And then some other practical things, avoiding stress, making sure you're getting enough rest. Definitely avoiding prolonged sun exposure. And if you're going to be in the sun, you should be wearing sunscreen. And you want to also let them know to avoid tanning beds as much as possible. So we don't want to completely erase the sun from their life. They still need sun, they still need the vitamin D, but they just don't need prolonged exposure. No sunburns, that's going to trigger an event. In extreme cases, we may need to think about surgical interventions. So the big one here might be a renal transplant. The number one cause of death for people with lupus is lupus nephritis. So they end up with kidney failure. So sometimes they have to have a kidney transplant because of that. And then if the joints become very inflamed, then they might end up with a joint replacement as well. So there's a lot of complications with lupus. Like I said, the number one complication is that lupus nephritis, which causes renal failure. So we definitely want to keep an eye on their BUN and their creatinine to make sure that that's not happening, and then look for other signs of renal failure too. They could have heart disease, lung disease, hypercoagulation, so they're going to be at risk for clots. So it's probably a good idea not to be taking oral birth control medications, because that can also increase your risk for clots. So we need to be mindful of DVTs, strokes, PEs, MIs, all of those things, anywhere that clot can go. And of course, because their immune system is so stressed already, and if they're taking immunosuppressants, they're going to be at a greater risk for infection. So think about all your infection prevention protocols, those things that we talked about in Module 1. So some nursing interventions, this is not all-inclusive, but some of the big things that we need to think about are definitely sunscreen, how to use it. They should be applying it 30 minutes before they go out into the sun, reapplying every couple of hours, and then wearing sun protective clothing. We need to teach them about energy conservation, so, doing your most important activities in the morning when you have energy, taking frequent rest breaks while you're doing things, and keeping up to date on immunizations because they are at a greater risk for infection. Just remember they can't take live virus vaccines, so that would be varicella, for example, or measles. And then avoiding those oral contraceptives because it can increase their risk for clotting. So they need to find another way to prevent pregnancy unless they're really working closely with their physician, their primary care physician, to get pregnant. Because pregnancy is such a big risk for somebody with lupus. So if they're not taking oral contraceptives, they need to use barrier methods or some other form of birth control. So please make sure you do your reading and your preparation for this so that we can talk about this a little bit more in class and do some activities. And I will see you there.